In this afternoon's health alert, the CDC has released disturbing new data today about an alarming spike in newborn syphilis cases. The agency says cases have reached dire levels, jumping more than tenfold in the past decade. Last year alone, more than 200 babies died from syphilis. It's alarming because 20 years ago, the sexually transmitted disease was practically eliminated.
Yeah, joining us now to talk more about this, ABC News medical correspondent Dr. Darien Sutton. Darien, Liz and I were shocked when we started reading a little bit more about this and the numbers that are out there. So how is this? Why is this happening?
I share that shock. A lot of the reason why this is happening is, as we were discussing during the break, a lack of access to care. The most concerning statistic in this is that 9 out of 10 of these cases could have been prevented with appropriate testing and treatment. So it's about patient communication, education, access to maternal health care, prenatal care, understanding what that test result means, and getting that appropriate treatment to prevent the risk and the complications.
And I think for most women of childbearing age, you just don't talk about syphilis in this day and age anymore.
Yeah. And it's not the bacteria that I'm concerned about, it's the stigma. A lot of this is centered around the stigma on infections and disease, and it often leads people to not wanting to get tested, not wanting to communicate that result, and not wanting to get that appropriate treatment. This test is most often, testing for syphilis is very commonly done early on in pregnancy, but the issue is that many people just simply do not have the access that we assume that most do. An estimated 20 million Americans don't have access to health care coverage, and this disproportionately affects Black mothers who unfortunately don't have that access to a comfortable, calm conversation with a quality care provider.
Right, because these diagnoses, they're almost happening in like emergency rooms versus with your doctor who you might have a relationship with, like your OB/GYN, because they don't have access to that, like in the state of Mississippi.
Absolutely.
Is there a way for a mother to know in advance, like through the symptoms, that they really need to get tested?
So there are symptoms that are associated with syphilis that can include a rash that can then translate to a rash that happens all over your body. But it's important to know that at least 50% of the cases are asymptomatic or no symptoms at all. And so that's one of the reasons why it goes untreated and untested and undiagnosed, and unfortunately we see the complications.
And if you do test positive for it, it's just an antibiotic?
It's just an antibiotic. It centers around penicillin. This treatment is to help prevent and treat the mother, and also to prevent the congenital syphilis, which can lead to complications in the child of their liver, their spleen, abnormalities in their eye development, and even abnormalities in their face in terms of changes and disfigurations. All of that can be prevented with a simple antibiotic by just getting that test.
And if not treated, it can sometimes be fatal?
It can sometimes be fatal. As you were just stating, there's 200 stillborns that were documented in this statistic, which is so concerning because when you look at that number, 9 out of 10, 90% could have been prevented by simply getting a test and simply getting that treatment.
It's such an alarming story. Obviously, healthcare systems, healthcare for women, needs to change in this country.
Yeah, we need to continue to increase access to maternal care in every county so that everyone can have a quality conversation with a provider to get that treatment.